Thank you very much, Kel. It is a Thursday tradition right here on Wake Up Today, answering your medical questions, concerns. And here to do that is Dr. Kalani Brady from the John A. Burns School of Medicine. Good morning to you, Doctor.
Good morning.
And you know what? I see you're wearing your proud St. Louis tie. I wanted to give a shout out to the young men of St. Louis. More than 100 of them graduated this past Saturday. I was at the ceremony. It includes Cord Medeiros, whose dad, President Glenn Medeiros, got an honorary degree from St. Louis.
Wonderful.
Isn't that wonderful? It was super nice to see. All right, let's get to the questions, okay? Because every week you get a number of calls. Okay, we had someone who called and said, I know it's rare for men to get bladder infections. What could be the cause? I know women are a little more susceptible to that than men are, right?
They have a short urethra or tube for the urine.
Okay.
But men have a longer tube, so it's rare. And it can be caused by urinary stones. It can be caused by an outpouching of the ureter, which we call a diverticulum, and then other abnormalities of the urine collection tract. A kidney stone, for example, could cause it. It is something serious enough to work up when you have a kidney stone, to see if you have a kidney stone when you have a bladder infection.
Am I the only guy out there when you say kidney stone who's like, oh, that just hurts? That's a tough combination.
You're not the
right
only
there.
guy.
Okay, I don't wish that on anyone. Someone was told that I have an abnormal aortic aneurysm. How can I control this? How often do I need to get a CAT scan?
An abnormal aortic aneurysm is an outpouching of the main vessel, sending blood to the body from the heart.
Okay.
And basically, that is an abnormality which, in its extreme, can lead to rupture or popping of the aneurysm, which is very serious and frequently deadly. So, number one, adequate blood pressure control. Really tight blood pressure control can help control the aneurysm. And if it gets too big, of course, surgery is in the works. So, CAT scan. You have a cardiologist if you have an abnormal aortic aneurysm, and the cardiologist will make the recommendation of how often to get a CAT scan.
Stay in contact and with your doctor on that one to make sure.
Absolutely.
Okay, lady says, I have a son, I shouldn't say that, I should say a parent says, I have a son who has keloids and has keloid treated with steroids. Is there any other way to treat them? What exactly is a keloid? A
keloid is a proliferation of scar tissue, so that when you have a cut, it basically turns into a mound. And keloids can be treated usually by steroid injections, small needle with regular steroid in the keloid. If you want another treatment, ask the very plastic surgeon or dermatologist who is treating the keloid, and they may have alternatives.
Okay. What doctor should you see when you have tingling, numbness, or if you have burning on the bottom of your feet?
I would start with your primary care doctor. If a neurologist is necessary, they'll send you. But this is a common problem, especially with early diabetics and late diabetics even. And so follow up with your doctor. There are treatments that will help.
I was going to say, the great thing is reach out to your primary physician, because then he or she can always sort of direct you into the right sort of course, right?
Absolutely.
Dr. Brady, we still got more questions. Can you join us in the next half hour?
I will be here.
Well, every Thursday we invite viewers to phone in their medical questions and concerns. Dr. Brady from the John A. Burns School of Medicine joins us now to answer some of them. And you say everything in moderation, so it's okay to have a donut tomorrow, right?
Sure.
All right, good. All right, let's go to the first question. You ready?
I'm ready.
All right, I know this one. I heard that Lyme disease is from deer ticks. Is it possible to get it from dog ticks in Hawaii?
No. The little germ that's in the deer tick is not resident in dog ticks.
Okay. So the next question we have, my granddaughter has these little warts on her knees. Is this for life?
It could be, but warts are generally treatable, Christine. The dermatologist or even your family practitioner can freeze a wart and it will go away, and it may not recur. So there are treatments for warts.
Okay. If you're aware of your heartbeat, is this a symptom of high blood pressure?
No. It could be a symptom of excitement. It could be a symptom of fear or anxiety, but generally it's not a symptom of high blood pressure. Generally, You can feel your heartbeat or hear your heartbeat if you're excited or if you're active, if you've just done some heavy weightlifting or just run 400 meters or something like that. But silent high blood pressure is the key.
I have this tingling in my right arm. Should I be concerned?
Tingling in the right arm, Christine, could mean that there's a nerve going down the right arm that is affected, that's causing the sensory part of the nerve or the tingling to occur. It also could be something more central up in the brain, and I would go into your regular doctor and have them diagnose what it is so it can be treated appropriately.
Is lupus hereditary? Are there different types?
Lupus is generally not hereditary, although there are some genetics that make it slightly more likely if you have it in the family. And there are different types, discoid lupus, for example, as opposed to systemic lupus erythematosus, which is the full-scale body lupus that many of us have heard about.
Okay. Are you recommended to have cataract surgery for the eyes? What are the repercussions for no surgery?
Generally, cataracts taken out will restore vision from that ground glass substance, which is the cataract. I've had both cataracts removed, and I can see now wonderfully in the 10 years since I've had them removed. So the repercussion of not having them out is basically progressive blindness, difficulty with acuity of your vision.
Okay, so don't be afraid. It is going to improve
It's
greatly.
a minor procedure.
Okay, good. My 82-year-old mother has a bleeding nose. Is this normal? What is the cause?
It's not abnormal. It does occur. And most common cause is a ruptured capillary or little blood vessel in the nose, which you can relieve with some pressure over time. However, there are more serious causes of bloody noses, especially if it's recurrent, such as a tumor in the nose, and I would get it checked out by a doctor.
I have this pain on the right side of my head, my cheek, my ear, especially when I touch it. What could this be?
It could be an ear infection or something wrong with the ear, a cerumen or wax impaction. It could be a dental abscess. There's a rare disease called giant cell or temporal arteritis that it could be. And I would go into the doctor who would want to deal with this pain. So go in, find out what it is, and treat it appropriately.
All right. Thank you, Dr. Brady, for being here. Have a
My
good weekend.
pleasure. You too.
Thank you. I will.